Good afternoon. This is our clinical chemistry diagnostic exams rationalization. I'm Dr. Gab Pascual, and I would be the one explaining to you the questions here in our diagnostic exams. Okay, so this is the distribution of scores for clinical chemistry 1. The average score was 58%. Ang highest naman was 94%. Okay, so what you can do is you can compare your score to the other students using this distribution. If you have a score greater than the average, then that's good. Okay? But you cannot be complacent. Hindi ka pwedeng mag-relax sa clinical chemistry 1. You still have to study this, of course. Okay? Now, if you have a score less than the average, you have to put extra focus, okay, on this exam. Alright? So, let's go to the questions. So, first question, which one of the following statements about lipoproteins is false? Okay, so ang incorrect statement natin dito is letter D. Elevated LDL causes a decreased risk of atherosclerosis. So, if you have questions like this, you have to be careful. Okay? Make sure na mabilugan nyo agad yung mga words na like true or false. Okay? Para alam nyo yung hinahanap ninyo. So, dito, what we are looking for is the incorrect statement. Okay, and the incorrect statement is letter D. Alright? Now, for us to understand this, you have to remember that LDL was called as your bad cholesterol. Okay, why is this so? Remember the function of LDL. LDL transports cholesterol to the peripheral tissues. Okay? So, if you have higher levels of LDL, mas marami yung build-up mo ng cholesterol to your peripheral tissues. And the problem is, this cholesterol, okay, let's just draw a blood vessel. This cholesterol can accumulate in the blood vessels and it can cause atherosclerosis. Okay, mag-accumulate siya dyan sa walls ng blood vessel and it will cause atherosclerosis. Atherosclerosis is bad because of the complications attached to it. So if this atherosclerosis gets worse, so dumami ng dumami yung cholesterol na nag-accumulate, yan, so lalaki yung atherosclerotic plaque mo dyan. Eventually, yung lumen or yung butas ng blood vessel, mas liliit ng liliit. And of course, yung blood, kaya na dumadali dun sa blood vessel would be less. And whatever organ is being supplied by this blood vessel would receive less blood. Okay? And this is tied, of course, to a lot of complications. A good example would be your myocardial infarction or heart attack. Okay? So atherosclerosis eventually can lead to heart attack. Alright? So this is the reason why if you have higher levels of LDL, you have a higher risk for atherosclerosis. Okay? Now HDL on the other hand, okay, is known as your good cholesterol. The reason behind this is that your HDL gets the excess cholesterol from the peripheral tissues, then it returns this back to the liver. So isipin niyo para siyang garbage truck. Okay? So opposite ng ginagawa naman ng LDL. So kung si LDL, it will increase your risk for atherosclerosis. HDL on the other hand will decrease your risk for atherosclerosis. Okay? Next. From the group of analytes below, which set would most likely be increased in type 1 diabetic patients in crisis? So let's talk about type 1 diabetes briefly. Type 1 diabetes mellitus is actually an autoimmune disorder. Okay? It is an autoimmune disorder wherein you have destruction of the beta cells of the pancreas. And can you remember the function of the beta cells? Your beta cells produce the hormone insulin, okay, which is your hypoglycemic hormone, meaning it lowers your glucose levels. Okay, so sa type 1, nasisira po yung beta cells, so eventually, the insulin levels decrease. Okay? So, dito sa choices natin, ang tinatanong, ano yung increased, okay, sa type 1 patients? Definitely, yung mga choices na may insulin would automatically be incorrect. Because we know that in type 1, insulin is decreased. Okay? In fact, in books, this is described as absolute insulin deficiency. Okay? Again, absolute insulin deficiency because of destruction of beta cells. Okay? Now, one of the dreaded complications of type 1 diabetes mellitus is diabetic ketoacidosis. Okay, this is actually the hallmark. Okay, this is the hallmark of type 1 diabetes mellitus. This is rare in type 2, but in type 1, patients can undergo diabetic ketoacidosis, wherein there is increased breakdown of fat, or what we call lipolysis. And when fat breaks down, you produce ketone bodies. Okay, so magkakaroon ka ng maraming ketone bodies, and eventually this leads to acidosis, okay, or in particular, diabetic ketoacidosis. So ketone bodies would be increased. Now, this is acidosis. So the pH, okay, eventually decreases. Okay, acidosis, decreased pH. Okay, so yung choice letter A natin, this would be incorrect kasi po yung blood pH should decrease, not increase. Okay, so we are now left with choice letter D. Ketone bodies would be increased, blood glucose would be increased. Okay? So ketone bodies, na-explain na natin bakit siya tumataas. Diba? So again, there's increased fat breakdown. Yung blood glucose mo, bakit tumataas? Kasi po, remember, in type 1 diabetes mellitus, you have deficiency of insulin, which is the hypoglycemic hormone. So kung wala po yan, eventually you go into hyperglycemia. Okay, so the correct answer is letter D. Okay, next. A test for microalbuminuria is used most often to monitor patients with which of the following diseases or conditions. So you are being asked about microalbuminuria. Okay, pag may mga terms na ganito na medyo unfamiliar kayo, try to dissect the terms. Okay, so microalbuminuria. Pag nakikita niyo yung urea, okay, this pertains to urine. Okay, so when you say microalbuminuria, you have the presence of albumin in the urine. Okay? Now, supposedly, yung albumin po, it shouldn't be found in the urine because of your glomerulus. Remember, yung glomerulus ninyo, it serves like a filter. Okay, it will filter plasma. Eventually, the ultrafiltrate will become the urine. If the glomerulus is functioning, maayos siya, walang problem, the albumin will not be able to pass through and you will not find the albumin in the urine. Okay, so yun ang normal. But in diabetes, okay, in diabetes, one of the complications would be what? You will have renal disease. Okay, so nag-lead to, okay, to many complications. One of them would be kidney disease. Okay, and what happens is nagkakaroon ng destruction ng glomerulus. And eventually, nawawala na yung function ng glomerulus, nakakapass through na yung albumin. And the albumin is then found in the urine. So what you call that is microalbuminuria. This is actually a good test, no, to monitor renal complications. Okay, monitor renal complications among diabetic patients. Now, can you remember the other organs affected in diabetes? So aside from the kidneys, affected din po yung mga neurons. Kaya nagkakaroon ng tinatawag na peripheral neuropathy. Peripheral neuropathy. So yung mga pasyente na may diabetes, marami sa kanila nagko-complain na, Dok, parang nagmamanhid yung mga kamay ko. Nagmamanhid yung talampakan ko. Okay, and it's because of the destruction of neurons, okay, due to diabetes. So that's one thing that you need to know. This will also explain kung bakit yung mga pasyente na may diabetes, minsan nasusugatan sila, tapos hindi nila alam na nasugatan na pala sila. Okay, kasi nagmamanhid po. Okay? Another organ affected would be your eyes. Okay? Ang diabetes, it could actually lead to blindness also. Okay? Very common cause of blindness din ang diabetes. Right? Kaya talaga kailangan yung mga diabetic patients na monitor natin yan and napapababa natin yung blood glucose nila kasi eventually the high blood glucose leads to a lot of complications. Alright? Next. Which of the following terms would be used to express the middle value in a series of results? So this question is about your laboratory mathematics. Okay? So sa clinical chemistry, may mga times talaga na kailangan yung mag-compute. Okay, kaya sa board exam, you are asked to bring a calculator. Now here, you're just being asked about a definition. So ang hinahanap is yung middle value. And this is your median. Okay? So define lang natin yung iba. Your mean, Okay, this is the average of your values. So you just add up all the values, then divide by the number of values. Alam natin yan kasi usually this is how we compute for grades, diba? So yun yung mean, or in layman's term, average. The other term that you need to know is mode. And when you say mode, this is the most frequent. Okay, most frequent value. Okay, so pag may set of numbers ka, yung number na pinakamaraming beses lumabas, that would be the mode. Alright? We will talk about the Gaussian distribution in a while. So next question. Which of the following best describes random error? Okay, so this is, the question is asking about random error. In the laboratory, we have two types. Okay, we have two types of errors. So one of them is your random error, and the other one would be your systematic error. Okay, marami talagang ganitong tanong sa clinical chemistry kasi part of clinical chemistry is your quality control and quality assurance. Alright? So, now, ano yung difference between random and systematic? When you say random, okay, these are errors, okay, which are present in all your measurements. Okay, so present lagi yan. You cannot completely remove them, but you can minimize them. And one thing that you need to know, the random error, okay, is also known as your bidirectional. Okay, bidirectional error. Ano ibig sabihin? Bidirectional. Dalawang direction. Ibig sabihin po, ang mga random errors, they will affect your results in two directions. They could either increase or decrease your results. Now, let me give you a concrete example. A good example of a cause of a random error would be fluctuations in the electricity in the laboratory. So, alam natin na nagfa-fluctuate ng kuryente. Minsan mataas, minsan mababa, and so on. So, this will affect your results, and your results would either be increased or decreased because of this cause of random error. Ang systematic error naman, on the other hand, okay, this will affect your errors in one direction only. So, either it will just falsely increase or falsely decrease all of your results. So, one direction lang. Good example would be the deterioration of reagents. So, pag nag-deteriorate yung reagents mo, yung mga results mo could either be increased lahat or decreased lahat. So, you can say that this is a cause of a systematic error. Alright? So, ang tama sagot po dito would be letter A. Results may be either above or below the mean. Okay? Two directions. Bidirectional ang random error. And this is actually a recall question. Next, a CSF glucose value is 62 milligrams per deciliter. What would you estimate the serum glucose? Okay, so this is testing, no, kung alam nyo yung relationship ng glucose CSF, okay, at saka yung serum glucose. You have to remember that your CSF glucose is 60 to 70% of serum glucose. Okay? So, laging mas mataas ang serum glucose. Alright? Laging mas mataas ang serum glucose. Yung CSF glucose mo would just be around 60 to 70% of your serum glucose. So, let's give a concrete example. So, halimbawa, yung serum glucose mo is 100 milligrams per deciliter. You can predict that your CSF glucose would be around 60 to 70 milligrams per deciliter. Okay, because we know na 60 to 70% ng serum glucose ang CSF glucose. Okay? You need to know this kasi pwede rin pong tanungin ito sa clinical microscopy. Okay? Dinidiscuss din to sa CM. You need to know this also because this is used in the diagnosis of a particular condition which we call bacterial meningitis. In bacterial meningitis, the CSF glucose, okay, the CSF glucose is decreased. Okay, so kukuha na mo yung pasyente ng CSF, kunin mo yung glucose nun ng CSF, then you compare it against the serum glucose of the patient. Pag nakita mo na decreased yung CSF glucose, let's say 40 or 30, ibig sabihin, no, or one possible implication is that the patient might be having bacterial meningitis. Okay? So sa question natin, ang binigay na value is 62 and this is CSF glucose. So you have to somehow estimate the serum glucose using this one. So what you can do is divide your 62 by 0.6 or 0.7. Okay? And whatever you will get, that's your estimated serum glucose. Okay? So hindi na ako magko-compute, pero ang pinaka-papasok po dito sa whatever na mako-compute natin is 93 milligrams per deciliter. Alright? So this is something that you need to know because this ties in with your clinical microscopy concepts. Next question. Which is the incorrect statement about sample labeling requirements? So sa clinical chemistry, or actually sa lahat ng subjects nyo, you have to study yung mga specimen collection, proper labeling, proper specimen processing, preservation, etc. Okay, important yan. Tinatanong rin po yan sa board exams. Alright? So ang incorrect statement po dito is letter A. Pre-labeled tubes should be used. Okay? So from your experience, alam natin no, na yung mga tubes natin dapat, hindi natin nilalabelan yan prior to collection. Because this is a cause of clerical errors. Okay? Pwede kasi mangyari no, na nilabelan mo na yung tube, tapos nagamit mo pala sa ibang pasyente. So magkakaroon ka na ng mix-up ng mga results. And that's not good. Alright? Tignan natin yung ibang choices. The date of collection should be included. This is true, especially in the laboratory, okay, or in clinical chemistry. Okay, kasi some of your tests no, can be affected if delayed or prolonged yung pagtetest natin. So, kailangan alam natin yung date. Actually, hindi lang date, pati time dapat. The label should have a unique identification number. Of course, this is true. Okay, para mas madali nating matrace back kung kaninong pasyente yung kaninong pasyente yung specimen. Okay? Then the label should have the patient's first and last name. Hindi pwedeng last name lang. Okay? Kasi maraming Pilipino ang pare-pareho na last name. Okay? Actually, hindi tayo contented with the name. Sometimes we also add another identifier, like for example, birth date. Alright? So yung mga ganitong questions, you can actually answer them based from experience. And this happens in the boards. Okay, may mga question na talagang kailangan mong i-recall yung experience mo nung ikaw ay intern. Alright? Next, which lipid abnormality is most closely linked to heart disease? So somehow we have already tackled this a while ago, and the correct answer is hypercholesterolemia. Okay, so again, if you have high levels of cholesterol, this leads to atherosclerosis. Next, periodic verification that a centrifuge is operating correctly is determined by, this is another recall question. Ang gamit po natin to check the centrifuge would be your tachometer. So the tachometer will measure the RPM or the revolutions per minute of your centrifuge. Kailangan kasi yung centrifuge mo adequate yung revolutions niya. Otherwise, hindi mo masiseparate na maayos yung specimens mo. Okay? And the way to check that is by using a tachometer. So pakitandaan na po iyan. Okay, next question. In a normal distribution, approximately what percent of data would be more than plus or minus 3 standard deviations from the mean? So what you're being asked here is about your normal distribution. The normal distribution is also known as your Gaussian. Okay, so this is also known as your Gaussian distribution. Okay, malilito. Pareho lang po yan. Okay? So ano ba yung Gaussian distribution? If you have a set of data in the laboratory, okay, so let's say test results. Usually, that set of data will follow this Gaussian or normal distribution. And it will look like this. Okay, so you have here a bell-shaped curve. At the middle of the bell-shaped curve, you have the mean. Okay. Then you have here your plus 1 SD. And this is minus 1. Then further away, you have your plus 2, then minus 2, then plus 3, and minus, sorry, that's minus 2. Then you have minus 3 here. Alright? Now, sa Gaussian distribution curve, if you take the data from minus 1 SD to plus 1 SD, okay, that would represent 68% of your values, okay, of your data. From minus 2 to plus 2, this will represent 95% of your data. Okay? From minus 3 to plus 3, that would represent 99% of your data. So let's give a more relatable example. Okay? So good example yung mga exam scores. Okay? So let's say for example, your average exam score is around 50. Okay? And the standard deviation was computed to be 5. Right? So pwede mo i-plot yan dito, and you can say that from minus 1 to plus 1, no, diba, 68% yan. So from 45 okay, to 55, yung range na 45 to 55, this will represent 68% of your scores. Okay? Na gusto mong malaman, ano yung range na magre-represent ng 95% ng scores. So, gamitin mo ulit yung values na to, mag-compute ka, 50 minus 2 SD, that's 50 minus 5 minus 5, so you will get 40. Okay? Then yung upper range mo would be 50 plus 5 plus 5, that would be 60. So, 40 to 60, yan yung range wherein you will find 95% of your scores. Na paano naman kung gusto mong malaman yung range kung nasaan yung 99% ng scores ninyo? Okay? So, ang hahanapin mo range would be your mean minus 3 SD up to mean plus 3 SD. So, ano yun? Okay? So, yung lower range mo would be 50 minus 5 minus 5 minus 5. So, that would be 35. Upper range would be 50 plus 5 plus 5 plus 5. That would be 65. So, this range, 35 to 65, would represent 99% of your scores. Alright? So, that's your Gaussian distribution. Now, dito sa tanong kasi, ang tinatanong is, approximately what percent of data would be more than the plus or minus 3 standard deviations from the mean? Okay, alam natin na itong plus minus 3 standard deviations is 99%. Ang hinahanap is yung nasa labas. Okay? Data, percent of data that would be more. Okay, yung nasa labas. So, ang sagot dito would be 1%. Okay? 100 minus 99 lang. Okay, so ang sagot, 1%. Okay, yan yung percent of data that would be outside your plus minus 3ST. Right? Next question. Okay, next question. In absorption spectrophotometry, okay, so pinapa-complete yung statement, no? Ang correct statement is letter C. Absorbance is directly proportional to concentration. So what is being tested here is your knowledge of the Beer-Lambert's law. Or what we know also as the Beer's law. Okay, this is very important when it comes to spectrophotometry, wherein we measure the amount of light absorbed. Yan ang mini-measure natin sa spectrophotometry. Amount of light absorbed. Or yung tinatawag na absorbance. Okay? Pag mas mataas yung absorbance ng isang solution, okay, we can say that the concentration is also high. Okay? Directly proportional po sila. Alright? Now, para mas maintindihan natin yung Beer-Lambert's law, okay, try to imagine a glass of iced tea. Okay? Pag nagtitimpla kayo ng iced tea, okay, pag nagtitimpla kayo ng iced tea, para ma-gauge nyo kung matapang ba yung iced tea or hindi kulang yung timpla, no? You look at the iced tea. Tingnan mo kung gaano siya ka-dark. Kung very dark yung iced tea, we can say that that iced tea absorbed a lot of light. Kaya nga kaya dark siya eh. Kaya na-absorb niya yung light. Okay? And alam mo, at the back of your head, no, na mataas yung concentration niya, matapang yung iced tea. Ganun din ang Beer-Lambert's law. Right? Okay. Next. Which of the electrodes below is a current producing or amperometric rather than a voltage producing or potentiometric electrode? Okay, so this question would be about your principles of electrochemistry. Okay, one of the things that you have to review in your principles of instrumentation. Okay? So, dito, sa mga ito, ang electrode na gumagamit ng amperometry would be your Clark electrode. Okay, some of you might note this as your PO2 electrode. Okay, yung PO2 electrode nyo, or PO2 ISE nyo, ion selective electrode, that uses amperometry. Okay, so tandaan natin guys, amperometry, an example of an electrode using this principle is your PO2 electrode. Okay? Now, How about yung mga electrodes na gumagamit ng potentiometry? Okay. Yung mga electrodes na gumagamit po ng potentiometry would be your pH and PCO2 electrodes. Alright? Yung PCO2 electrode nyo, this is also known as your Severing-Haas. Okay, Severing-Haas electrode. Ito yung choice letter D. Okay, so yan po potentiometry yan. Itong pH electrode, potentiometry din. Okay? So, important na alam natin itong mga to. Yung mga examples ng electrode na and yung anong principle yung ginagamit nila. Okay, in one board exam, around, I think, March 2016 or March 2017, tinanong po in one board exam, no, kung ano yung principle ng pH electrode. So, ang sagot is potentiometry. In the same board exam, tinanong din ano yung principle naman ng PCO2 electrode. So, ang sagot would be potentiometry also. Okay? So, kung alam mo yun, 2 points ka kaagad dun sa board exam na yun. Okay, next. Keldall's procedure for total protein is based upon the premise that, so letter C, the nitrogen content of proteins is constant. Okay? Your proteins, particularly your serum proteins, okay, these are 16% nitrogen. We know this. Okay, 16% nitrogen ang serum proteins mo. So if you can measure the nitrogen, you can also correlate that with the protein concentration. And that is the basis of your Keldall's procedure. Please take note, no, that your Keldall's procedure, okay, this is the reference method. This is the reference method for total protein analysis. And would you remember, sino naman yung routine method? Ang routine method naman natin is your Biuret reaction. Okay, Biuret reaction. Okay, in the Biuret reaction, on the other hand, what you have would be copper ions, okay, attaching to the peptide bonds in your proteins. Peptide bonds. Okay, copper plus peptide bonds. This will form what we call your Biuret complex. And madaling tandaan yung color ng complex na yan. Okay, so Biuret, violet. So again, Keldall's reference. Ang Biuret, routine method. Okay? Next. Creatinine is considered the substance of choice to measure endogenous renal clearance because, so the answer would be letter B. It is completely filtered by the glomeruli. Let's first take a look at the other choices. So choice letter A, clearance is the same for both men and women. This is not true. Remember, your creatinine comes from your muscles. Okay, nasa muscles po yan. And we know that your men and women have varying muscle mass. Okay, of course, mas maraming, relatively, no, mas maraming muscle ang lalaki, muscle mass ang lalaki. Okay? So, obviously, yung creatinine ng lalaki, mas mataas din on average compared sa mga babae. So, letter A is incorrect. How about letter C? The rate of formation per day is independent of body size. This is also incorrect since pag mas malaki yung body mo, obviously, mas malaki din yung muscle mass mo. And mas mataas yung creatinine mo. Okay, so this is incorrect. Dependent po yan sa body size. Alright? Plasma levels are highly dependent upon diet. Okay, so this is also incorrect. Ang creatinine po natin in our plasma is not that affected by diet. Okay, that's one advantage of measuring creatinine actually. Okay, ang naapektuhan ng diet would be your BUN. Okay, that's your blood urea nitrogen. Ang urea po, okay, urea, okay, this comes from your protein metabolism. So pag mas marami kang protein sa diet mo, mas mataas ang urea. Okay, recall that urea is also used to assess your renal function, just like creatinine. But between creatinine and urea, mas favored ang creatinine. Kasi less ang mga factors na nakaka-affect sa kanya. Okay, ang tatandaan nyo dito kay creatinine is, ang nakaka-apekto sa kanya is yung muscle mass. But for urea, affected siya also by the protein in your diet. So, ang tamang sagot dito is letter B. It is completely filtered by the glomerulus. Remember, yung clearance, okay, yung mga clearance tests ninyo, this actually assess your glomerular filtration function. glomerular filtration. Okay? And ang ginagamit natin routinely for this purpose would be your creatinine. Okay? Next, select the primary reagent used in the JAF method for creatinine. So your JAF method is for your creatinine. And what happens in your JAF reaction is creatinine reacts with your picric acid. Okay, and this forms a red-orange complex. Okay, and take note that this happens in an alkaline solution. So ang reagent po dito is picric acid. Okay, something that you also have to remember about the JAF reaction is that the JAF reaction is non-specific. Non-specific siya. Maraming interfering substances na pwedeng makaapekto sa results natin when we use the JAF reaction. Okay? Pagdating ng lecture natin on clinical chemistry, I'll be discussing how we modified the JAF method to make it more specific. Okay? So, ang tamang sagot po dito, letter C. You have picric acid and sodium hydroxide. The sodium hydroxide would make your solution more alkaline. Okay? Thus, making your JAF reaction possible. Okay. Next. Which of the following hormones promotes hyperglycemia? Okay, so you also need to know kung sino yung mga hormones na nagpo-promote na hyperglycemia. Let me enumerate them for you. So, ang mga nagpo-promote na hyperglycemia would include your cortisol, which comes from your adrenal cortex. You have your growth hormone, which of course comes from the anterior pituitary. Okay. You also have the thyroid hormones, T3 and T4. The thyroid hormones are also hyperglycemic. Okay. Then you have your catecholamines, your epinephrine and norepinephrine. These are also hyperglycemic. And another one would be your somatostatin. Okay? Ang nag-iisang nagpo-promote naman ng hypoglycemia is insulin. Okay? We have mentioned that already a while ago. Okay? So tama sagot, letter B. Now let's briefly discuss the roles of the other hormones here. Your aldosterone increases sodium reabsorption in the kidneys. Okay, and this is part of your RAAS, renin, angiotensin, aldosterone system. Okay? Calcitonin, on the other hand, is hypocalcemic. Calcitonin is hypocalcemic. It will lower your calcium levels. Okay? Would you recall kung sino yung mga hypercalcemic na hormones naman? Ang hypercalcemic would be, susulit natin, hypercalcemic, this would be your PTH, parathyroid hormone, and vitamin D. Alright? Now, how about renin? What is the action of renin? Okay, recall question yun. What is the action of renin? Renin converts angiotensinogen to angiotensin 1. Okay, and this is also part of your RAAS, just like aldosterone. Okay? So maraming questions sa clinical chemistry about your hormones. And during our lectures, we would go over all of these hormones. Alright? Next. Which of the following is the reference method for measuring serum glucose? Okay? Now, for your methods for glucose, you have two groups. Okay? You have your chemical methods, okay, and your enzymatic methods. The chemical methods rely on the reducing property of sugars. Okay? So, a lot of your carbohydrates are reducing. Yan ang ine-exploit ng mga chemical methods. And because of this, your chemical methods are very non-specific. Okay? Hindi lang glucose yung mami-measure mo. Pwede ka na mag-measure ng ibang sugars, like, for example, galactose, which are also reducing. Okay? So, ang preferred natin, of course, would be your enzymatic because these are more specific. Okay, and I want you to remember, under enzymatic methods, you have your hexokinase method, okay, and your glucose oxidase. May iba pa, pero ito yung dalawang must know natin. Hexokinase method and glucose oxidase. Okay? Ang reference method is your hexokinase. Right? Next. Okay, so let's go to clinical chemistry 2. So for CC2, the average score was 55%. Then the highest score was 94%. Again, if your score is above average, then good for you. But again, you should not be complacent. Hindi ka pwedeng mag-relax sa CC2. Okay? If you are below 55%, you have to put extra effort in your CC2 studies. Okay? Now, sa legend, by the way, we divide clinical chemistry 2 into CC1 and CC2. Okay, this is unlike what we do in your undergrad. Diba, nung undergrad, you have CC1, CC2, and CC3. Okay, sa legend, more of CC1 and CC2 lang. So CC1, it's more of your introduction to clinical chemistry. Nandyan yung specimen collection, nandyan yung instrumentation, nandyan yung quality control. Then you also have carbohydrates, lipids, okay? Then proteins, yan, CC1 yan. Other than those, CC2 na po yun. So obviously, mas malawak yung scope ng CC2. Kaya talagang kailangan nating araling mabuti ang CC2. Okay, so let's go to the questions. Okay, first question. In electrophoretic separation of lactate dehydrogenase, an electrophoretic separation of lactate dehydrogenase isoenzyme that demonstrates elevation of LD1 greater than LD2 could be indicative of, so the answer would be hemolysis. So let's briefly discuss your LDH isoenzymes. LDH has 5 isoenzymes. So 5 po sila. Okay? And these are comprised of 4 subunits. The subunits could either be H or M. Okay? And these 5 types of or 5 isoenzymes are comprised of various combinations of this H or M subunit. Okay? Now in serum, normally LD2 has the highest concentration. Okay, tandaan na, sa serum, LD2 ang may highest concentration. This is followed by LD1, then LD3, 4, then lastly, LD5. Yan ang pagkakasunod-sunod nila when it comes to concentration in the serum. Now, in some conditions, LD2 and LD1 can get flipped. Ito yung tinatawag nating flip pattern. A flip pattern or LD flip. Okay, and you only have to think about 2 conditions wherein this happens. The first one is more serious. That would be your acute myocardial infarction, heart attack. Okay, so pag inaatake ka, mas maraming LD1 ang nare-release from your heart. Okay, and eventually this exceeds the LD2 concentration. The other condition wherein you see the LD flip would be hemolysis. Okay, so pag nakita kayo ng LD flip, huwag kayong magpapanik agad na, uy, inaatake yung pasyente. Okay? Check your specimen. Baka naman may hemolysis. Okay, so that's your LD flip. Alright. Next. Which of the following tests is the best screening test for neural tube defects? So, take note, no, ang tinatanong best screening test for neural tube defects. This can actually be asked also in clinical microscopy, particularly when you discuss amniotic fluids. Okay, but important din na pag-aralan natin siya sa CC kasi pwedeng tanungin dito. Okay, so ang best screening test po would be alpha-fetoprotein. The alpha-fetoprotein can be measured in your amniotic fluid, okay, or in the maternal serum. So usually maternal serum na yung ating specimen kasi mahirap po mag-collect ng amniotic fluid. Okay? So, if the AFP is increased, this could indicate neural tube defects. Okay? An example would be your spina bifida. Spina bifida. Okay? Yung decreased AFP, meron din po yung clinical significance. Your decreased AFP is seen in Down's syndrome. Okay, madaling tandaan, decreased AFP, Down's syndrome. Okay? Now, once you become an adult, hindi na dapat present ang AFP. Remember, AFP means alpha-fetoprotein, di ba? So, fetus, dapat yun lang ang may AFP. Pero ang adult, walang AFP. Okay? If you find AFP in adults, that is actually a tumor marker. And I want you to remember kung para saan po siyang tumor marker. AFP is a tumor marker for hepatocellular carcinoma. Hepatocellular carcinoma. And some of your testicular carcinomas. Okay, as well as some ovarian cancers. Okay, ovarian cancers, okay, or ovarian carcinoma. Okay, so very useful ang AFP. Okay, again, increased AFP in your amniotic fluid or maternal serum, neural tube defect. Decreased AFP, Down syndrome. Sa adults naman, tumor marker siya. Alright? Next, 8-hydroxyquinoline and orthocresoftalin complex zone are commonly used in the determination of, the answer would be calcium. So sa clinical chemistry, meron talaga tayong mga kailangang i-memorize na reagents like this one. Okay? And memory work talaga yan, guys. What you can do is repetition. Okay? So talagang repetition lang para ma-master natin. Next, where are the most acute phase proteins synthesized? So the answer would be your hepatocytes. Okay? Of course, these are found in the liver, okay, which is the source of your acute phase proteins. Let us remember what acute phase proteins are. Acute phase proteins are proteins which increase in concentration when you have an inflammatory process. Okay? So pag may inflammatory process ka, magkakaroon ka ng increased synthesis na acute phase proteins by the liver. Okay? So some examples would include your CRP, that's your C-reactive protein. We measure this as a marker of inflammation. So most of you might have encountered this already during their internship rotations. Diba? CRP, that's a marker of inflammation. Another acute phase protein that I want you to remember is your serum amyloid A or SAA. Okay, serum amyloid A. Why is this important? Kasi po, sa board exam, okay, particularly in immunosero, tinanong na before, sino daw yung mga acute phase proteins na nag-increase by 1,000 times, okay, in an inflammatory process. So Morse type yan. Kaya ang answer would be CRP and serum amyloid A. Okay? Of course, marami pa pong acute phase proteins. You have to go over them. You have to memorize them. Kasi minsan ang tanong naman, which of the following is not an acute phase protein? Okay? Next, lipase is predominantly produced in what organ or tissue? Okay, so this is about enzymology. So the answer would be pancreas. Okay, and lipase, okay, this is measured in the diagnosis of acute pancreatitis. Ang kagandahan ng lipase, very specific siya for your pancreas. So pag nakita mong mataas ang lipase, mataas dapat ang suspicion mo na baka yung pasyente nag-acute pancreatitis. Can you remember the other enzyme used for acute pancreatitis? Okay, anong enzyme yon? That enzyme would be your amylase. Okay, so lipase and amylase, these are used for the diagnosis of acute pancreatitis. Now, the problem with amylase is that aside from the pancreas, your salivary glands also produce amylase. Okay, so medyo less specific siya compared to lipase. Kaya pag tinanong kayo, which enzyme marker is more specific for acute pancreatitis, ang sagot nyo dapat, lipase. Okay, although amylase can also be used. Okay, next. So this would be about acid-base disorders. Okay? Medyo mahirap yung topic na to, I know. Okay? Marami sa inyo nainis dito nung undergrad. But I would try to make this easier for you when pagdating ng ng discussion on clinical chemistry. Okay? So you would be asked to interpret your ABGs. So para ma-interpret yung mga ABGs ninyo, you have to remember the normal values. Okay, most of the time, they do not give the normal values. But for the sake of the diagnostic exams, minigay po natin dito. Okay? So, let's try to interpret this. So, una yung titignan lagi, guys, is the pH. So, the normal pH is 7.35 to 7.45. 7.28 is decreased. Okay? So, meaning, the patient is undergoing acidosis. Okay, so kagandahan dito, kapag yung choices mo may alkalosis na, pwede mo na eliminate yun. Okay, pero dito kasi mostly acidosis yung choices. Ang pwede nating eliminate sa ngayon is yung healthy condition. Okay, hindi yan healthy. Hindi mo makita yan sa normal individual. Next. Ang next mo i-determine would be the cause. So what is causing your acidosis? For us to know this, you have to remember the relationship of pH with your bicarbonate and your CO2 levels. Okay? Your bicarbonate is directly proportional to pH. So, ibig sabihin, pag tumaas po yan, tataas ang pH. Or pag bumaba siya, bababa ang pH. PCO2 on the other hand, carbon dioxide on the other hand, is inversely proportional to pH. Okay, kaya siya nandiyan sa denominator. Inversely related siya sa pH. So, pag tumaas ang CO2, bababa ang pH. Or pag bumaba ang CO2, tataas ang pH. So, ngayon, ang next mong gagawin, tignan mo yung mga results mo. Yan. Look at bicarbonate. The normal is 22 to 29. This would actually depend on what textbook you're using. But this is obviously increased. PCO2 is 65. The normal is 35 to 45. Okay, ito yung usual na ginagamit na value dito. So obviously, the carbon dioxide is also increased. So tanongin mo sarili mo, between these two, sino kaya ang magpapababa ng pH? Sino magpapababa ng pH dyan? Is it the increased bicarbonate or is it the increased CO2? Pag nag-increase ang bicarbonate, balik tayo dito. Pag nag-increase ang bicarbonate, bayin ko lang yung color na ink ko. Yan. Pag nag-increase ang bicarbonate, what happens to pH? The pH increases. So obviously, this is not compatible as the cause. Okay? Kasi pag tumaas yung bicarbonate, dapat sana tataas yung pH. Kung yan man yung cause. How about yung CO2? Pag tumaas ang carbon dioxide, anong mangyayari sa pH? Correct, bababa, 'di ba? So ito yung compatible natin na cause. Okay, so the CO2 is causing the acidosis. So since CO2 yung affected, CO2 yung nagko-cause na acidosis, you term this as respiratory acidosis. O eliminate mo na yung mga metabolic. Okay? So let's not stop there. May sinabi siya dito, sabi niya uncompensated. Ano bang ibig sabihin pag sinabing uncompensated? Pag sinabing uncompensated, yung nagko-compensate, kulang pa. So in this case, since CO2 yung problem mo, CO2 yung cause ng acidosis, yung bicarbonate naman yung compensatory mechanism mo. Siya yung nagko-compensate dapat. Okay? Hindi pwedeng yung isa na nga yung cause, siya pa yung magko-compensate. Okay? Yung kabila dapat na magko-compensate. Alright? Tulungan sila. Okay, so yung bicarbonate, nag-increase po yan kasi gusto niyang mag-compensate. Remember, pag tumaas ang bicarbonate, tataas ang pH. So ang ginagawa ng pagtaas ng bicarbonate dito is it is trying to increase the pH back to normal. So compensation yung bicarbonate. Pero ang tanong, sapat na ba yung compensation? Hindi pa. Kasi yung pH mo, hindi pa normal. So you say that this is uncompensated. Okay? Pero pag naging normal na yan, you can say na compensated na siya. Alright? So next. Hydrogen ion concentration in blood is usually determined by means of which of the following electrodes. So this is another memory type of question. So the answer here would be glass. Okay? So yung electrode for your pH uses a glass membrane. Okay? So for pH, glass membrane. Now, ano yung laging tinatanong dito? Ang laging tinatanong actually is yung membrane for your potassium electrode. Ang membrane for your potassium electrode uses valinomycin. So, tandaan na po natin ito. This is a recall question. Paboritong tinatanong yan. Okay? The membrane for potassium is made of valinomycin. Next. Which type of kinetic reactions are reactions in which the enzyme is in excess and the substrate concentration is the limiting factor? Okay, medyo wordy yung question, no? Anong tinatanong sa inyo dito? Ang tinatanong lang dito is anong type ng reaction kung saan yung substrate ang nakakaapekto dun sa reaction. Okay? So let's try to recall the relationship of your substrate concentration to your reaction velocity. So we have drawn here a graph. So on the x-axis, you have substrate concentration. On the y-axis, you have reaction velocity. Okay, so anong relationship ng dalawang yan? Pag tinaas mo yung substrate mo, dinamihan mo yung substrate mo, yung reaction velocity mo also increases. Mas bumibilis yung reaction. You can think of it this way. Imagine niyo parang may factory kayo. Yung enzymes niyo, mga machine. Yung substrate, yun yung mga materials. If you add more substrate or you add more material, mas bumibilis yung production mo sa factory. So parang ganito yan. Okay? However, guys, eventually, yung graph natin nagiging ganito. Nagpa-plateau na siya. Okay? To the point that eventually, it reaches a maximum velocity. Okay? Why is this so? This happens because at this point, your enzymes are already saturated. Okay? Nagkakaroon na ng saturation ng enzymes. So again, go back to your factory analogy. So sa factory mo, limited lang yung number ng machines. Magdagdag ka ng substrate, well and good, bibilis yung reaction velocity. But if you add more and more and more substrate, eventually overloaded na yung machines, hindi na nila mapaprocess yung mga additional substrate. So kung ano yung maximum rate mo, yun na yun. Kaya hindi na tataas yun. Okay? Kasi overloaded na or saturated na yung mga machines mo or yung mga enzymes mo. Now, at this point, kung saan linear, ito po, kung saan linear ang relationship ng substrate and reaction velocity, we say that the reaction is following first-order kinetics. Okay? Dito naman, sa plateau, we say that the reaction is following zero-order kinetics. So, ang tanong dito, substrate concentration as the limiting factor. Substrate concentration yung nakaka-apekto dun sa reaction velocity mo. Saan yun? That's your first-order kinetics. So in first-order kinetics, mas marami pa rin yung enzyme kaysa sa substrate. Pero pagdating ng zero order, babaligtad. Mas marami na yung substrate, okay, kaysa sa enzyme. Kaya nga may saturation. Okay, next. Proteins in a buffer that sets the pH at 8.6 okay, will become blank and migrate to the blank. Okay, so ang answer dito is that your proteins would become negatively charged. Okay, and since they are negatively charged, they migrate to the positive electrode. And the positive electrode is your anode or cathode? Sa ano naalala nyo guys? Ang positive electrode is the anode. Okay? So important concept to guys, when you do electrophoresis, your support medium, okay, so this is your support medium. Your support medium should be dipped in a buffer, and the buffer should have a pH of 8.6 para negatively charged yung proteins. The way I remember this is that I write protein, no? Tapos yung letter N dito sa dulo, negative. Okay? So at 8.6, negatively charged yan. Now if you put your proteins here, if you put your specimen here, tapos nandito yung positive electrode, nandito yung negative electrode, the proteins will tend to migrate towards the positive electrode. Okay, parang magnet lang, opposites attract. Okay, so remember this concept for electrophoresis. Okay, next question. Unconjugated bilirubin is water insoluble. Conjugated bilirubin can be excreted in the urine. So you are being tested about your knowledge of the types of your bilirubin. So there are two types of bilirubin. You have your unconjugated, okay, and your conjugated. The unconjugated one, okay, the unconjugated type is water insoluble. Okay, hindi siya natutunaw sa tubig. Conjugated, on the other hand, is water soluble. Now you have to remember that your urine is mainly made of water. Okay, so mostly tubig ang ihi. Kaya po, yung conjugated bilirubin, yaan ang natatagpuan sa ihi. Okay? Unconjugated bilirubin, on the other hand, is water insoluble. So it is found bound to albumin. And since it is bound to albumin, it cannot pass through the glomerulus. Therefore, it cannot be found in the urine. Okay, so important concept yan. So, tingnan natin yung statements. Unconjugated bilirubin is water insoluble. This is correct. Conjugated bilirubin can be excreted in the urine. So, this is also correct. Okay, so both statements are correct. Next, which reagent is used in the Gendrasik Groth method to solubilize unconjugated bilirubin? Okay, now, yung Gendrasik Groth method na to, this relies on the classic diazo reaction. In the classic diazo reaction, bilirubin reacts with your diacetylsulfonilic acid diacetylsulfonilic acid to produce azobilirubin. Okay? Now, the problem is, yung classic diazo reaction, it will only react with the water-soluble bilirubin. Sino yung water-soluble? Okay, correct. That's your conjugated. So, si conjugated lang ang magre-react directly with the classic diazo reaction. Kaya nga, si conjugated bilirubin, another name for it is direct bilirubin. Okay, kasi it directly reacts with the classic diazo reaction. Now, if you want the unconjugated bilirubin to react, you have to add an accelerator. So, the accelerator will solubilize the unconjugated bilirubin. Okay? Yung accelerator nyo in your Gendrasik Groth would be caffeine. Okay? 50% methanol, this is used in your Evelyn-Malloy. Okay, Evelyn-Malloy method. Okay, so pareho pong gumagamit ng classic diazo reaction yan. Ang difference lang is the accelerator. Okay? So next. The next question. Which form of hyperbilirubinemia is caused by an inherited absence of UDP-GT? So the answer here is Crigler-Najjar syndrome. Among the choices, there are actually two conditions wherein you have a deficiency of UDP-GT. By the way, what is UDP-GT? UDP-GT is your conjugating enzyme. Okay, it will add two glucuronic acid molecules to your bilirubin to form your conjugated bilirubin. Okay, so UDP-GT, yan ang role niya. Okay, in Crigler-Najjar, okay, and Gilbert syndrome, you have a deficiency of this enzyme. Yung Gilbert syndrome nyo, mas mild yung deficiency. Okay? Crigler-Najjar is more severe. Actually, there are two types. You have type 1 and type 2. Crigler-Najjar. And type 1, okay, is complete absence. So, better answer here is Crigler-Najjar. Now, how about the other choices? How about Rotor syndrome and Dubin-Johnson? In Rotor syndrome and Dubin-Johnson, the problem would be excretion of bilirubin. Okay, excretion of bilirubin, particularly your conjugated bilirubin. Nabubuo yung conjugated bilirubin. So, walang problem sa enzyme mo. Ang problema lang, yung conjugated bilirubin, hindi mo matapon sa bile duct, so hindi siya makapunta sa intestines. Okay, so eventually it accumulates and you suffer from what? Conjugated hyperbilirubinemia. Okay? Okay. Which of the following dyes is the most specific for the measurement of albumin? Now, yung question na to, supposedly this is in Clinical Chemistry 1, medyo naliligaw siya. Okay, but huwag kayong magugulat na may mga ganitong questions talaga sa boards. Sometimes nagkakaroon ng crossover ng questions between two subjects. So, minsan yung question sa CC nasa HIMA or yung question sa HIMA nasa CC or and so on. Okay, nagkaka-crossover sila. So, huwag kayong magagalit kasi ganun talaga. Okay? Now, for the measurement of albumin, yung dyes na gusto kong tandaan ninyo would be your BCG, Bromcresol green, and Bromcresol purple. Okay? Your Bromcresol green is the more commonly used. BCG. Okay? But BCP is the one which is the most specific. Okay, most specific for the measurement. It's most specific for the measurement of albumin. Okay? Which of the following statements is true? So the answer is letter A. about definitions lang din naman to. Your holoenzyme is comprised of the apoenzyme, no, and prosthetic group. So ano ba yung mga yan? I have to remind you that your enzymes sometimes require the use of cofactors. Okay? Some of the enzymes require cofactors. Okay? Some of the cofactors are organic non-protein. Okay, and these organic non-protein cofactors are what we call your coenzymes. Okay, coenzymes. So, kailangan po sila ng enzyme. Otherwise, the enzyme will not work. Okay? Now, if the coenzyme is tightly bound, okay, dikit na dikit siya dun sa enzyme, you call that as a prosthetic group. Okay, coenzyme po yan na nakadikit na dun sa enzyme. Okay, so ito yan, prosthetic group. In that case, you will also call the enzyme as the apoenzyme. And the combination of these two is your holoenzyme. Okay? Tingnan natin yung ibang choices. All enzymes have optimal activity at pH 7. Is this true? Okay, this is false. Okay? Pag may mga choices kayo guys na ganito, may all or none, medyo maging suspicious kayo dapat. Okay? Usually mali yung mga ganyang choice. Now, it is true that a lot of your enzymes will have an optimal activity at pH 7 to 8. Pero may mga exemptions tayo. Like for example, acid phosphatase. Acid phosphatase has a optimal pH of 5. ALP on the other hand will have an optimum pH of 10. Okay? So pakitandaan po yan. Kaya nga tinawag si ACP na acid phosphatase. Si ALP naman alkaline phosphatase. Okay? Next, a coenzyme is an inorganic molecule required for activity. So ano nagpamali dito? Yung inorganic. Coenzymes are organic. Okay? Next, cofactors are as tightly bound to the enzyme as prosthetic groups. Hindi po. Okay? Prosthetic group yung tightly bound. Okay? Which of the following enzymes is a transferase? So you need to know your enzyme classification. So enzymes are classified into 6 classes. You have your oxidoreductases, transferases, hydrolases, lyases, isomerases, and last, ligases. So these are the 6 classes of enzymes. And in the board exams, they would ask you about the examples, no, of each class. Okay, parang dito, which of the following enzymes is a transferase? The answer would be creatine kinase. So creatine kinase is a kinase. Yung mga kinases nyo po, these are transferases. Kinases transfer phosphate groups. So under sila ng transferase. ALP is a hydrolase. LD is an oxidoreductase. Amylase is a hydrolase. So pagdating ng lectures natin, I will teach you how to memorize these ones. Okay, next, which condition produces the highest elevation of serum LDH? So the answer here is pernicious anemia. Okay, so more of ano lang din to, memory work. Okay? Tandaan na rin natin, highest elevation naman ng CK. Okay, this is caused by Duchenne's muscular dystrophy. Okay. Now, how about highest elevation of ALP? Highest elevation naman ng ALP is seen in Paget's disease, or what we call osteoitis deformans. Okay, so as early as now, try to burn this at the back of your mind para mas maalala natin pagdating ng board exam. Okay, so let's go to Clinical Chemistry 3. Okay, so first question, which of the following is a component of antifreeze that can cause severe renal tubular damage along with similar effects of alcohol poisoning? So yung question na to is on toxicology. Okay, ang toxicology medyo memory work lang din. Okay, and actually this question can also be asked in clinical microscopy. So pag nakita niyan, antifreeze, ang iisipin nyo lang, ethylene glycol. Okay, so of course hindi ito common sa Pilipinas, hindi tayo gumagamit ng antifreeze agents dito. Okay, but in Western countries, no, kung saan may winter, mga ganyan, they have to use ethylene glycol as an antifreeze agent for their vehicles. Okay? Now, sa clinical microscopy, bakit to nabanggit? Nabanggit to sa CM kasi po may characteristic crystal, okay, in ethylene glycol poisoning, and that's your CaOx monohydrate. Okay, so pakitandaan guys, no, for clinical microscopy. Next. Pheochromocytoma is a tumor of the adrenal medulla that results in elevated urinary levels of all of the following except, so the answer is cortisol. Your pheochromocytoma is a tumor of the adrenal medulla, particularly of the chromaffin cells. Okay, chromaffin cells of the adrenal medulla. The chromaffin cells produce your catecholamines. So, sino yung mga catecholamines nyo? You have your epinephrine and norepinephrine. Okay? So, X agad yung free catecholamines. Now, how about this one? Vanillyl mandelic and metanephrine. Yung vanillyl mandelic acid and metanephrines, these are metabolites of your catecholamines. And they can also be found in the urine of patients with pheochromocytoma. Okay, ang problema ng mga patients na may pheochromocytoma, sobrang dami ng kanilang catecholamines. So they get the signs and symptoms of someone, no, na mataas yung epinephrine and norepinephrine. Mabilis yung pagtibok ng puso, high blood. Okay, actually this is one cause of hypertension, no, pheochromocytoma. Laging pinagpapawisan and so on. Okay? An adult's plasma cortisol of 22 micrograms per deciliter at 8 a.m. and 10 micrograms per deciliter at 4 p.m. would be what? So, ang tinetest sa inyo dito is kung alam nyo ba yung diurnal variation. Okay, diurnal variation or diurnal rhythm of cortisol. Okay, remember, cortisol is higher in the morning. Okay, particularly the time that you wake up. Mas mataas ang cortisol. Okay, and bababa na yan throughout the day. So, pag nakita kayo ng pasyente na mataas sa umaga, okay, then mas mababa sa gabi, that's normal. Okay, so found in a healthy individual. The other condition that you want to contrast this with is your Cushing syndrome. So, in Cushing syndrome, no, you have hypercortisolism. And what we see here is consistently mataas sa umaga and mataas sa gabi. Okay? So, Cushing syndrome. Maraming causes ng Cushing syndrome. We will tackle that when we go to your lectures. Okay, next. Drug that is administered through which of the following routes will reach peak level the quickest? And obviously, this is your intravenous route. Dineretso mo na yung drug dun sa dugo. So, agad-agad, you will reach the peak level. Okay, another thing that you need to know about the intravenous route is that this is the route which achieves 100% bioavailability. Okay, so when you say bioavailability, this is the amount of the drug that reaches systemic circulation. Okay, so kung dineretso mo na yung drug dun sa blood vessel, syempre lahat ng drug makakarating dun sa systemic circulation mo, makakarating dun sa dugo. Okay, so 100% bioavailability intravenous. Now, how about yung iba? Let's say for example, oral. Ang oral ba nakaka-achieve ng 100% bioavailability? Well, in some cases yes, pero most of the time less than 100% yan. Okay? For the reason that we have what we call your first pass phenomenon. Okay? First pass phenomenon. Lahat ng drugs na tinikin mo orally, okay, na na-absorb sa intestine, they will all first pass through the liver. And in the liver, some of these drugs would be metabolized, so less na yung makakarating sa bloodstream. Therefore, less than 100% bioavailability. Okay? Next, the parathyroid hormone is important in the regulation of, the answer would be calcium and phosphate. So, parathyroid hormone is a hypercalcemic hormone. Okay, it will increase your calcium in the blood. And PTH achieves this, okay, by targeting 3 organs. So, these 3 organs would be your bones. Okay, in the bones, it will increase bone resorption. Okay? When you hear the term resorption, isipin nyo digestion. So parang nadadigest yung bone. Siyempre, pag nadigest mo yung bone, mare-release yung calcium. Okay? So hypercalcemic. Another effect of your PTH would be on your intestines, wherein it will increase calcium absorption. Mas marami ka na-absorb na calcium through your diet. Then another target would be the kidneys, wherein your PTH will increase calcium reabsorption. Okay, imbis na iihi mo yung calcium, i-reabsorb mo siya. Okay, so that will lead to hypercalcemia also. Now, how about phosphate? Kung si PTH hypercalcemic, remember, phosphate on the other hand goes down, okay, as an effect of PTH. Okay? The reason behind this is that there is increased phosphate excretion in the urine as an effect of PTH. So, baliktaran. Pag may hyperparathyroidism ang pasyente, you expect hypercalcemia and hypophosphatemia. So, baliktaran. You have to contrast this with your vitamin D. Vitamin D, on the other hand, also increases your calcium, but it also increases your phosphate. Okay? So, parehong magi-increase as a response to vitamin D. Okay? So, if you want to differentiate a patient suffering from hyperparathyroidism and a patient suffering from vitamin D overdose, look at these two analytes. Okay? Kung baliktaran yan, mataas ang calcium, mababang phosphate, hyperparathyroidism. Kung vitamin D overdose naman yan, parehong mataas ang calcium and phosphate. Okay. A deficiency in which of these vitamins leads to increased clotting time and may result in hemorrhagic disease? The answer is vitamin K. You have to remember that vitamin K, okay, is important in the synthesis of your factors 2, 7, 9, 10, as well as your protein C and protein S. Okay, this is collectively we call this as your prothrombin group. Okay? So medyo may tie-in to dun sa hematology, 'di ba? Vitamin K is important for the production of these coagulation factors. So without vitamin K, you will not be able to produce these coagulation factors in their functional form. Okay? And you will now suffer from hemorrhagic disease. Mataas yung risk mo for bleeding. Okay? And it is also important for us, no, to remember that warfarin inhibits the action of vitamin K. Okay? Kaya nga pag nag-warfarin overdose, one of the things that we are looking for would be your bleeding disease. Okay? Hemorrhagic disease. Yeah, remember, warfarin is a vitamin K antagonist. O, sige, tingnan natin iba. How about vitamin C? Pag may deficiency ka ng vitamin C, what do you call that condition? Okay, very good. That's your scurvy. Riboflavin is your vitamin, ano to guys? Vitamin B2. Okay, and bihira po ang deficiency ng vitamin B2. Pyridoxine is your vitamin B6. And usually B6 deficiency leads to problems in your amino acid metabolism. Okay, so sa clinical chemistry, you also have to review your vitamins. You also need to know their other names. And you need to know the conditions caused by deficiencies of these vitamins. Okay. Measurement of 17 ketosteroids in urine is performed to assess primarily which organ? 17 ketosteroids po. Okay. Testis and adrenal cortex. 17 ketosteroids would be one of the precursors of your androgens. Okay. So, yung testis mo, of course, this produces androgens. Adrenal cortex, it can also produce androgens. Okay, regarding therapeutic drug monitoring, which of the following statements is correct when collecting a specimen for a throw level? So, what do you mean by throw level? Okay. So, ganito yan. Pagka-administer natin ng drug sa pasyente, so this is blood concentration on the y-axis, then this is time. Pagka-administer ng gamot sa pasyente, dahan-dahan mo yung ma-absorb, so dahan-dahan din tumataas ang blood concentration. But eventually, the drug gets metabolized and excreted, so bumababa yan. Then magbibigay ka na naman ng gamot, so tataas. then eventually bababa. Ito po, okay, kung saan meron tayong highest level ng drug in the blood, okay, that is what we call your peak level. Highest concentration yan. Ito namang pinaka-baba, okay, pinaka-mababa, that's your throw level. So sa TDM, they want to ask you, no, kung kailan dapat nagko-collect ng specimen for the peak level and the throw level. Okay? Yung peak level, kailangan yung specimen makollect yan around 30 minutes or 1 hour after the administration of the drug. Okay? So let's say, halimbawa, dito in-administer yung drug. Hindi pwedeng dyan ka rin mag-collect ng dugo for the peak level. Okay, kasi kailangan pa ma-absorb ng drug. You have to collect the specimen around 30 minutes to 1 hour after the administration kapag peak level. Throw level naman, okay? Throw level naman would be collected immediately prior to when the next dose of the drug is given. Okay, so remember this for your TDM, yung timing ng specimens. Okay, FSH. FSH is produced by, the answer would be pituitary. Okay, particularly the anterior pituitary. So sa endocrinology, you need to know the endocrine glands. Then you need to know their hormones. Okay, so thyroid gland, of course, thyroid hormones. And ang lagi nakakalimutan, calcitonin. Calcitonin comes from the thyroid gland. Pituitary, okay, you have the anterior, okay, and the posterior pituitary. The anterior pituitary produces FSH, LH, TSH, ACTH, growth hormone, and prolactin. So, 6 yan. Okay, tandaan na po natin. Ang posterior pituitary, it does not produce hormones. Instead, it stores oxytocin and ADH, antidiuretic hormone. The adrenal medulla, we have discussed this already. It produces catecholamines. Adrenal cortex will produce a lot of hormones. Okay, it will include this will include mineralocorticoids like aldosterone, mineralocorticoids like aldosterone, glucocorticoids like cortisol, then your sex hormones. Okay, so again, you have to know the endocrine glands and the hormones that they secrete. Okay, next. Currently, the most common method for the confirmation of serum barbiturates is, okay, so lagi guys, no, kapag nagka-encounter kayo ng drugs, no, measurement ng drugs, usually, ang ginagamit natin is GCMS. Okay, lalo na sa drugs of abuse, GCMS for confirmation. So, ano lang yan, tatandaan lang din natin yan. Another recall question. Okay, so, hindi lang serum barbiturates, basta kahit na ano ibigay sa inyo drug of abuse, no? Ang iisipin nyo lagi, GCMS, unless specified. Syndrome of inappropriate ADH secretion causes what? Okay, so the answer would be low serum electrolytes. For us to understand this, you have to remember the action of ADH. Remember, ADH, okay, increases water reabsorption in the kidneys. Okay, in the kidneys. Pag dehydrated ka, tumataas ang ADH, and ang gustong mangyari ni ADH, i-reabsorb mo yung tubig. Okay, imbis na iihi mo. Kasi nga, di ba, dehydrated ka na. Alang namang iihi mo pa yan. Okay, so ADH will prevent further loss of fluids. Okay? Now, in SIADH, you have over-secretion of ADH. This could be because of a tumor. Okay, so yung tumor nagpo-produce na ADH uncontrollably. What would happen is that you have uncontrollable reabsorption of water too in the kidneys. So, sobrang dami mong tubig na nare-reabsorb. Okay, anong problem dyan? That water would of course dilute the electrolytes. So, magkakaroon ka ng low serum electrolytes. So, low electrolytes. Like for example, sodium. So, sodium would be decreased, potassium, etc. Okay? Actually, pati mga proteins magde-decrease. Think of any analyte in blood, no? Madadilute yan, so magde-decrease yan falsely. Okay? Hypernatremia, this is of course incorrect. Sabi nga natin, low sodium, dahil nga nadadilute. Okay, low serum vasopressin. Vasopressin is another name for ADH. So obviously, in SIADH, mataas po ang vasopressin, hindi po siya low. Urine osmolality to be lower than plasma, hindi rin po. Remember, kapag may SIADH ka, sobrang dami ng ADH, sobrang dami ng tubig na nare-reabsorb. So yung ihi mo, very concentrated. The urine becomes highly concentrated. Therefore, you have increased urine osmolality. So increased urine osmolality as a result of SIADH. So this would be incorrect. Okay, so the answer would be letter B. Which set of results is most likely in an adult male with primary testicular failure? Now we know that the testis produces testosterone. Okay, and what stimulates the testis? Okay, teka. Murahin ko lang to. The testis produces testosterone. And what stimulates the testis to secrete testosterone would be your FSH and LH. So this work hand in hand, no, for the testis to release testosterone. Now in primary testicular failure, dissect niyo yung term, testicular failure. Nagfe-fail yung testis, so the testosterone levels go down. Okay? So anong mangyari sa FSH and LH mo? The FSH and LH, which come from the, what organ? Kakabanggit na natin. Anterior pituitary, okay, would be increased. So sa anterior pituitary, madedetect niyan. Uy, ang baba ng testosterone. Sige, taasan natin yung FSH and LH para ma-push natin yung testis na mag-produce ng testosterone. So ano yung mga results mo? Ito po. Decreased testosterone, increased LH, increased FSH. Okay? A similar concept can be applied to women undergoing menopause. Okay? Or women with ovarian failure. So, ganun din. Yung ovaries, yan na nagpo-produce ng estrogen. And what causes the ovaries to produce estrogen would be FSH and LH. So, they work hand in hand. Kapag nag-fail yung ovaries, estrogen would not be produced. Or kapag nag-menopause ka, okay, kulang na yung production ng estrogen mo. So what the anterior pituitary will do is it will try to push this by increasing the FSH and LH. So kapag may menopause ka or ovarian failure, mababang estrogen, mataas ang FSH, mataas ang LH. Okay? In fact, nice to know lang, in patients no na nagtatanong no kung doc pa-menopause na ba ako, one thing that we can do is to increase to measure the FSH. And if you see an increase in FSH in a woman around the 50s, let's say ganyan, papunta na ng menopause yan. Around 40s pala. Okay? Ang average na age ng Filipina na nag-undergo na menopause would be around 48. Parang ganun. So kung gusto malaman kung papunta ka na ng menopause, check the FSH. Okay? So endocrinology po yan. Next, hyperparathyroidism is most consistently associated with, we have already discussed this, remember, your parathyroid hormone, or PTH, no, targets the bones, intestine, and kidney. Okay? In the kidney, it will increase calcium reabsorption, but it will also increase phosphate excretion. So, in hyperparathyroidism, hypercalcemia and hypophosphatemia. So the correct answer is letter D. Next, serum TSH level is almost absent in. Okay, so the answer is primary hyperthyroidism. Now for us to understand this, you have to review your hypothalamus, pituitary, thyroid axis. So the hypothalamus, pituitary, and thyroid work hand in hand, no, in the production of your T3 and T4. The hypothalamus produces the hormone TRH to stimulate the pituitary to produce the hormone TSH. Okay? And TSH will stimulate the thyroid gland to produce T3 and T4. Okay, so that's the HPT axis. The HPT axis is governed by negative feedback. Okay, what do you mean by this? If you have increased levels of T3 and T4, mataas na yung T3 and T4, this will send signals to the pituitary to Okay? Decrease the TSH and decrease the TRH. So parang sinasabi ni thyroid na uy, tama na, mataas na yung T3 and T4. I'm doing my job. So, babaan nyo na yung TSH, babaan nyo na yung TRH. Ang tawag natin doon, negative feedback. Okay? Now, in your thyroid disorders, let me just clear my screen. Yan. Yung thyroid disorders nyo, they can be classified as primary, secondary, or tertiary. Okay, when you say primary, nasa thyroid ang problem. Secondary, nasa pituitary. Tertiary, nasa hypothalamus. Okay? So, primary hyperthyroidism, ano nangyayari dyan? Mataas ang T3 and T4 mo. Sino may kasalanan? Primary yan. So, ang may kasalanan, thyroid mismo. Anong gagawin ng pituitary kung mataas ng T3 and T4? Remember, negative feedback. So, TSH should be decreased. Okay, that's the thyroid profile in primary hyperthyroidism. In secondary hyperthyroidism, on the other hand, mataas ang T3, mataas ang T4, okay? But the problem lies in the pituitary. And the pituitary is producing too much TSH. Okay? Yung TSH na yan yung nagda-drive ng increase in T3 and T4. Primary hypothyroidism, anong problem dito? Mababa ang T3 and T4. Okay? And ang may kasalanan, thyroid. Anong gagawin ng pituitary mo? The pituitary will produce higher amounts of TSH. So, mali din yan. Okay, so, answer is primary hyperthyroidism. Now, yung euthyroid 6 syndrome, when you find this term, no, euthyroid, ang ibig sabihin yan, na normal, U nga eh. Okay? And that's a topic for another discussion. Medyo mahabang usapan. Okay, next. Which route of administration is associated with 100% bioavailability? We have discussed this already. This is your intravenous route. Okay, again, when you say bioavailability, this is the percent of the drug, okay, or the amount of the drug which reaches the bloodstream. Okay, and when you give the drug directly through the intravenous route, obviously 100% lahat ng drug mapupunta sa bloodstream. Okay, last question. Which of the following is the best analyte to monitor for recurrence of ovarian cancer? The answer would be CA125. So tumor markers, they could also be asked in clinical chemistry. They could also be asked in immunosero. Kaya kailangan i-memorize po natin yan. So let's take a look at the other options. CEA, or your carcino-embryonic antigen. Okay, this is used as a marker for colorectal cancer. Okay, madaling tandaan, CEA, letter C, colon. CE125 is for ovarian. The way that we try to remember this is that, di ba, CE125, take a look at number 5, mukha daw buntis. Okay, parang ganun. Mnemonics lang. Okay, CE15-3, this is for breast CA. And how do you remember this? Okay, take a look at the number 3, mukha daw breasts. Okay, so CA15-3. Then CA19-9, this is for pancreatic CA. Okay, so how do you remember this? Yung number 9, pagka hiniga daw natin, mukhang baliktad pala. Pag hiniga natin siya na pag ganito, mukha siyang pancreas. So, ganyan yung itsura ng pancreas kasi. Okay, so again, review your tumor markers. You need to know the conditions, no, or the cancers na ginagamit, kung saan ginagamit yung mga markers na to. Alright? So, that wraps up our CC rationalization. I hope you have learned something from this, and I hope na medyo na warm up kayo from our diagnostic exams. Okay? So, this is just the second week of our online review. Matagal-tagal pa tayong magsasama, and I hope marami kayong matutunan sa amin. And of course, we also expect that you do your part, no, na you study well for the boards. Okay? Aral lang ng aral na mabuti, guys. And eventually, you will get your ultimate goal, which is to pass the boards, get high board ratings, and top the board exam. Okay, aim high, aim for the top. Okay, thank you for listening to our rationalization.